Okay, let's dive into this. Most people assume Medicare Part A is just entirely free. And honestly, for a lot of people, the premium part of that is true. But what surprises almost everyone is what it actually costs when you have to, actually use it. A single hospital stay in 2026 could literally leave you with a bill of over $1,700 before Medicare pays a single cent. And the craziest part, that number can reset multiple times in the exact same year. In this explainer, we're going to decode exactly what Medicare Part A covers, what it's going to cost you in 2026, and the one crucial thing about benefit periods that almost nobody understands until it is way too late.
$1,736. I'm just going to pause for a second and let that shock factor really land. Remember, that is the bill you can get hit with before Medicare pays a dime. It's not some annual maximum out-of-pocket limit like you might be used to. It is an upfront deductible that hits right away. And the most shocking reality of this $1,736 deductible is that it's entirely possible to have to pay it more than once in the very same calendar year. So here's our roadmap to logically break this all down today. We're covering the Part A shock, exactly what Part A covers, who pays for it, how those tricky benefit periods and costs work, and finally we'll look at what is specifically not covered.
All right, kicking things off with Section 1, the Part A shock, and that massive $1,736 deductible we just talked about.
Moving right into Section 2, what Part A actually covers, or what we can think of as the 4 pillars of hospital insurance. Let's slow down a bit and really digest what this means in the real world. Part A is essentially your hospital insurance for inpatient care, and it stands on 4 specific pillars. First up, inpatient hospital stays. If you're officially admitted to a hospital, Part A is what foots the bill for your room, your meals, the nursing care, and most of the medications you get while you're in there. Pillar 2 is skilled nursing facility care. So let's say you have a hospital stay of at least 3 days, and then you need some short-term rehab or nursing care to get back on your feet. Part A steps in to cover your time in a skilled facility. Third is hospice care. For folks facing a terminal illness, Part A completely covers hospice services, and that includes pain management, comfort care, and really vital support for the family. And finally, the 4th pillar, some home health care. If your doctor officially certifies that you need skilled nursing or physical therapy at home, Part A can actually cover those visits.
Okay, on to Section 3, who pays for it. Let's take a look at how Part A premiums actually work. Now, despite that terrifying deductible we talked about earlier, here is the good news. Most people do not pay a monthly premium for this coverage. If you or your spouse worked and paid Medicare taxes for at least 40 quarters, which is basically 10 years of work, your premium is absolutely $0. Boom. In fact, about 99% of beneficiaries get it for free. But for that other 1%, the costs are pretty steep based on these verified 2026 CMS figures. If you work between 30 and 39 quarters, your monthly premium is $311. And if you have under 30 quarters of work history, you're looking at the full premium of $565 every single month. Which brings us to Section 4, benefit periods and costs. Now, listen closely, because this core mechanism is the absolute most important part of this entire explainer. Here is the giant trap so many people fall into. Part A does not function with a standard annual deductible. It just doesn't. Instead, it operates on something called benefit periods. A benefit period is a coverage window that kicks off the very day you are admitted to a hospital as an inpatient. And here's the kicker. It only ends when you have been completely out of the hospital and haven't received any skilled nursing care for 60 consecutive days. So what does this actually mean for your wallet? It means every single time a new benefit period begins under that 60-day rule, you are on the hook to pay that $1,736 deductible all over again. Have 2 hospital stays 6 months apart? You're paying it twice. So let's walk through exactly how this aggressive timeline plays out during a hospital stay. Days 1 through 60, you pay that upfront $1,736 deductible, and Medicare handles the rest. But hit day 61, and things escalate fast. For days 61 through 90, you're suddenly paying $434 per day in coinsurance. And if your stay goes beyond 90 days, you have to start dipping into your lifetime reserve days. You only get 60 of these for your entire life. They never, ever renew. And in 2026, using just one of those reserve days will cost you a staggering $868 out of pocket per day.
And this brilliantly illustrates how things shift if you need to recover in a skilled nursing facility. It's a slightly different structure, but equally crucial to understand. Step 1. Assuming you had a qualifying 3-day hospital stay first, days 1 through 20 in the facility are fully covered by Medicare. Step 2. For days 21 through 100, you are hit with a $217 per day coinsurance. And Step 3. Once you pass day 100, Medicare pays absolutely nothing. You are entirely on your own.
All right, pivoting to Section 5. What is not covered? Because honestly, knowing what is left off the table is just as vital as knowing what's on it.
These are the exclusions that surprise people every single time. Part A does not cover private nursing care. It won't pay for a private hospital room just because you'd prefer one. It actually has to be deemed medically necessary by a doctor. Simple comforts like personal care items, completely out of pocket. And the biggest shocker of all, it does not cover long-term custodial care in a nursing home.
I cannot emphasize this enough. Medicare does not cover long-term care. If you need ongoing custodial help with normal daily activities, things like bathing, getting dressed, or eating, usually just because of aging or a chronic condition, that is entirely outside of Medicare's scope. Long-term care is practically guaranteed to be one of the absolute biggest unplanned expenses in retirement. Expecting Part A to swoop in and cover it is a massive mistake. Now, how to pay for that is a totally separate conversation, but man, is it an important one to start having.
So the absolutely crucial takeaway here is that your $1,736 deductible is per benefit period, not per year. Knowing that changes everything about how you plan for healthcare costs. But let me leave you with this thought. With Medicare Part A covering exactly 0 days of long-term custodial care and with hospital deductibles that can literally reset every 60 days, is your retirement safety net truly as secure as you thought it was? I want to know what you think. Leave your Part A questions in the comments below. I read every single one. And make sure you stick around for our next explainer, where we are going to decode the monthly premiums and wild rules of Medicare Part B. I'll see you there.